Hello, and thank you for everyone who has joined us today. I should also say Happy New Year, Happy 2024. And particularly as we look at the upcoming year, we are going to be really busy. There's a lot as an agency that we're going to be focused on, particularly going to be prioritizing finishing those key areas for Governor Holcomb that are our priorities, and also addressing new issues. And so today in our agenda, we'll cover both of those, a little bit around the Medicaid forecast, and then legislative and some of our other priorities. So of the biggest new issues, really, as an agency that we're going to be focused on and addressing is the fiscal sustainability of the Medicaid program. As many of you likely saw in the December Medicaid forecast, there was a $1 billion variance. And I think it's important first just to break that down a little bit to clear up any confusion. Of that, $300 million is from the prior biennium. So it goes back to the December 2022 forecast. And that really involves a reconciliation. There are $700 million that we're talking about that is in this current forecast in the 24 and the 25 years. And so that is the area that we're going to be predominantly focused on. And when we think about what a $700 million variance means, it means that if we don't put some steps and some policies in place to address this, we would need an additional 700 million more state dollars than we were budgeted for. And so I think everyone recognizes that that's a really big issue. With this type of variance, combined with just the growth that we've seen in Medicaid over the last several years, if we don't act, the sustainability of the whole Medicaid program really becomes called into question. And so when we first learned about this, what did we do? So the very first thing we did is we formed a SWAT team, and this really consisted of agency executives and key subject matter experts in our agency. And we asked them to stop all their non-essential work. And we came together as an agency across our divisions to really look at and identify what the causes of the variance were. One big issue is like, how did we miss this? And what do we need to do? And what do we need to put in place to prevent something like this, certainly something as large as this, from happening again in the future? And then also looking at this, what are the main drivers of the increased expenditures that we are projected to need? So I'm going to start there, what the drivers of the variance are. I think in the simplest terms, it comes down to the fact that we have seen more individuals come on the aged and disabled waiver than we forecasted. And then when we look at individuals on the waiver, we see really dramatic increases in service utilization, far above what was forecasted back in April. And so when you combine more people with much more services, and then factor into that rate increases that we put in place in the last session, we see almost half of the $700 million variance resulting from this. Now, within the specific areas where we've seen service utilization growth, by far the largest was in an area called attendant care. And so when we think about that, what is attendant care? In the simplest description, attendant care, the way I think about it, it's helping individuals who are on the waiver with what we typically will call activities of daily living. Think of these things like helping somebody get dressed in the morning, or bathing, or feeding. And it can be other things like meal preparation or even transportation. What it's not, though, and it's important to note, it's not a skilled service in the professional sense. It's not nursing. It doesn't require a specific degree. It doesn't involve things like medication administration. So how are we going to address the forecast variance? I lump our strategies really into three big categories: the short term, medium term, and long term. So start with short term. When we think about what a short-term strategy is, in the simplest sense, this is things that are in our control today, things that we can already do, and that we already have the authority to enact. Now, some of those items are around how we, FSSA, do our forecasts. And we want to make sure that we put things in place right now to assure that we do everything we can to decrease the risk of variance this large occurs again in the future. And how do you do that? As you might imagine, in a program as large and as complex as Medicaid is, there's a lot of assumptions that go into projecting how much costs will grow over a biennium. It includes things like how many more people do we think are going to be enrolled in Medicaid? How medically complicated are those individuals going to be? How many services are they going to use? How many people are going to come off Medicaid? And so for us, we have to do a much more detailed review of assumptions before we make forecasts. And we need to do so to make sure that the things that we are seeing and that our partners and you all are seeing in the community on the ground and your own experience match up with the data that we have. And speaking of data, that's another area that we've got to do better at. We have got to get much better data faster. Forecasts will often use data that can at times be 3 to 4 months old. And so that means doing a forecast, we could miss emerging trends that are occurring in that time frame, as happened in the April forecast. We also need much better surveillance on our expenditures, particularly in our waiver programs. And doing so is going to give us a much better ability to identify faster emerging trends, and obviously with that, any potential or emerging risks. Now, there are some other short-term strategies that we are going to be doing around the waivers. This includes doing a better job of reviewing service plans to make sure that they are very person-centered and that they are approving the appropriate amount of utilization. And we really base that on what CMS has approved in our waiver definitions. Also, as part of this, we are going to be pausing our expedited eligibility program for our aged and disabled waiver. Now, this is an important program for us, and we are just pausing it. It's important because as part of our long-term work to allow more individuals to stay in their community, we want to be able to speed up the time it takes to find them to be eligible. And so the fact that we're pausing it is not so much of a cost control measure. Rather, it really is going to allow us to put in changes that will address operational problems that we've seen since we've begun with it, problems that really called into the fidelity of the model that we were approved with by CMS. So we are going to be working on this. It will require for us systems level changes, and so that will take some time. And so we're building that and anticipate resuming expedited eligibility in the summer of 2025 when we roll out the new eligibility level of care process as part of the Pathways program. Across all of the things that we're doing, but particularly these that fall into the short-term category, we are going to work really closely with our AAAs and our other case management partners on these processes. Now, I'm going to go out of conventional order and I'm going to skip medium and I'm going to write to long-term strategies. When we think about those, this is work that we will be doing with fiscal leadership in the governor's office, really to address the rate of expenditure of growth in Medicaid. And what I mean by that, it's not just related to the recent variance, but rather the rate of growth that we have seen independent of this variance. And so this is really going to start looking at long-term strategies that may have some impact in this biennium, but more importantly, will assure that in the next biennium, that we are seeing budgetary needs grow at a much more sustainable pace. And so this is going to require ongoing work. And with those strategies, and as we identify them, we will certainly bring those back and share those with you and our other stakeholders. Now let's talk about medium-term strategies, because these are the changes that we're going to be instituting here shortly as well, that I think there will be a lot of questions around. The reason we bucket these as medium-term is that these are changes that do require some level of CMS approval. And for these, we have very intentionally tried, truly to the maximum extent possible, to tailor our strategies to the causes of the variance while simultaneously balancing and seeking solutions that still meet the needs of those eligible for the waiver. I will say that is not always an easy task, but I do think we have thoughtfully approached that and found a really good middle ground. As of Wednesday, we put out for 30-day public comment the HCBS waiver changes that we are proposing. Now, as I've noticed before, or as I've noted before, some of these changes are in our short-term strategies and don't require CMS involvement. But one of the items that we have included is really clarifying what services a legally responsible individual, sometimes you'll hear the term LRI, can provide. First, before I explain that change, I want to communicate that we understand this is difficult and that some families are understandably concerned about these changes. We hear those concerns. And as I will describe shortly, we will work with every member and their families with the transition plan, which will include the option for legally responsible individuals to continue to provide a compensated service. So with that out of the way, let me give a little background. The age and disabled waiver, in fact, all of our current waivers do not currently allow legally responsible individuals to provide attendant care. By definition, as laid out by CMS, legally responsible individuals are parents of a minor child, a spouse, or a legal guardian. And the reason for this definition is that it acknowledges the fact that when a caregiver lives in the same house or same location with the individual in need of the services, it can present some really unique challenges. And so the changes that we have proposed do not prevent a legally responsible individual from being paid to provide care for the loved one. Rather, it puts those services in the appropriate service category, and that is called structured family caregiving. Structured family caregiving takes into account this unique nature of receiving support through somebody who lives with you. It emphasizes maximizing the member's ability and independence, as well as supporting the caregiver through training and support. And as a result, the service requirements include regular home visits from caregiver coaches and nurses, along with respite care, which is really important because families who are caregivers are going to need breaks as well for this themselves. And all of this is delivered through a daily reimbursement rate that allows a fluid movement between daily life and care needs so that caregivers don't need to separate what is an activity that a paid caregiver provides and what is it one that a family member does. And as a result, this model of care is truly ideally suited for supporting legally responsible individuals who are paid to provide care to their loved ones. Now, members who have a legally responsible individual right now providing attendant care will have several options. So for example, they can transition to structured family caregiving if they want a legally responsible individual to continue to support them. This will require some CMS authority that is in these waiver documents. They may also choose to have another non-legally responsible individual provide that care. So legally responsible individuals who are spouses can move right now to structured family caregiving. Now, parents of minor children will be able to continue to provide attendant care until structured family caregiving by a legally responsible individual in this category is authorized by CMS. They will, however, they will need to get support from their care manager and service teams today, and going forward, we will need to work with them to start thinking about their future options and planning for that transition. One misconception that we've heard already is around receiving structured family caregiving, and that may prohibit nursing level care. Under structured family caregiving, an individual can still get skilled nursing care. It does not prohibit that. A few other changes that are in our revised waiver documents that are up for public comment include decreasing the number of waiver slots that we have and pausing on the 2% rate index that was proposed last session. Home and community-based providers and other providers last session saw the largest rate increases they have had in recent years. Now, part of our rate setting process is that we will review their rates again in 4 years. Now, for the years in between rate reviews, we have proposed a 2% rate increase each year. And that would have gone into effect for some providers in this upcoming July, but we are currently pausing that. And I deliberately say pausing because pending on where we land with some of the things we're doing to address our expenditure growth, we will certainly want to be able to revisit this and potentially reinstate pending the success of some of these initiatives. For folks, and I know there's a lot of questions on this, we have created a website to address some of the common concerns that we're hearing already. And if you go to our FSSA homepage, you will see on the left navigation bar that there is going to be a link called Medicaid Strategies, and that will include FAQs, and resources and information. And as we learn more, we will continue to update that so folks can stay up to date on the changes that are coming. Now, although much of the last 2 months, a lot of the hours of the day have been really focused on the forecast and our variances, we are still continuing to do the other important aging related work that is in our legislative and in the governor's priorities. And one part of that is Governor Holcomb's agenda, which includes our multi-sector plan on aging. So what is a multi-sector plan? I think the simplest way I think about it, it's a state working together across agencies and with external partners, folks like AARP and our AAAs, to put together really a 10-year plan that will better support aging Hoosiers and communities across the state. I think most folks know that we are seeing a rapid growth in the aging population, and we're going to have more folks by 2030 over the age of 60 than we do under the age of 17. Something like 1 in 5 Hoosiers will be over the age of 60 in the next 5 years. And so we as a state need to put together a plan that's going to better support these aging Hoosiers in their communities across the state. And the recommendations that this group will bring forth will be medium and long-term as well. And they're going to address things not just like common topics we think about, like health coverage, but around housing, transportation, economic security, et cetera. So we have been doing some work internally on this and are really excited now to turn that externally and start working with a lot of you all and other partners to roll this out over the next several years. So really excited about this priority and really excited to have the governor's support on this. Another item that we are going to continue to work on, and which has been one of our priorities for the last several years, is the launch of our Indiana Pathways for Aging program. As mentioned before, this work is truly aimed at helping more aging individuals stay in their homes and their communities. And despite everything that's going on, we are still on target with launch this summer. And in preparation for that, we are working really hard with our managed care partners, Anthem, United, and Humana. We're working really hard to make sure that they are ready and that we are ready to make this transition as smooth as possible for those 100,000 or so individuals who will be moving from fee-for-service into managed care. So part of that right now is awareness. And so if you have not already seen it, you will likely see commercials and ads around the Indiana Pathways program. So keep an eye out for those. And also that we're going to continue to work on our level of care assessment representative program, or what we call LCAR. This will really standardize and speed up how we do level of care assessment for individuals who are coming into the Pathways program. We are also working as I mentioned earlier, to update our expedited eligibility program. And so we anticipate launching these two together in tandem in the summer of 2025. Another item that you'll see this session and that will certainly be coming over the next year is work that we're doing and really looking at how we currently provide adult protective services around the state and really rethinking the future of that and rethinking a different model of providing that. So expect more updates on that in future calls. Now, another governor and agency priority that we continue to work on and will work on this session is around increasing access, increasing quality, and increasing the affordability of childcare across the state. Now, when I hear access, when we think of access, I really think of it as two things, right? For one, it increases the number of childcare seats, which is a way of saying that we have more spots available for more children around the state. But you can't increase seats if you don't also increase the number of teachers in the classroom to serve those kids. And so the governor has been super focused for the last several years on supporting the workforce in general, but also specifically the childcare workforce. So one item on his agenda this year is making it easier for individuals who themselves have children in need of childcare to work in the childcare profession. And by doing so, we will make them and increase the threshold for them to qualify for our voucher programs. And the hope is that that is going to drive more individuals to consider a career in early learning and to better retain those who are already in the profession. We are also proposing to lower the age at which children can work in childcare facilities and adding childcare as a profession to the next level job programs. And I think together, this really has the ability to elevate childcare as a profession around the state. One, by providing grants and training for individuals who want to get certification, and the other by introducing this career much earlier in the workforce pipeline to kids in the high school time frame so that we can get more folks going into this field. Along with the workforce, we have been working really hard on increasing the number of seats as well around the state. We have done so in part through two really large and important grants. One was a $10 million provider, a series of provider grants. And collectively, that increased the number of childcare seats around the state by about 1,500. So pretty substantial benefit there. Another is a $25 million series of employer-facing grants. And these are grants that go to employers who want to either provide on-site or near-site childcare at their actual facilities, or who want to partner with local childcare providers to increase the number of seats or provide financial supports to their workforce. Now, we have finished round one of those awards and we selected 64 finalists, and really collectively, those finalists alone would potentially impact hundreds of thousands of hardworking Hoosiers. We've got another round of employer-facing grants that we'll announce later this month as well. Now, in addition to growing seats, we also want to support providers and make it easier for them to go into the business of childcare and to stay in the business of childcare. And as part of that, we are really working on how do we streamline and reduce the number of regulations or the regulatory burden that providers face at the same time, and always at the same time, while balancing the safety of the environment for children. We're also going to explore some new business models of childcare providers. This includes piloting micro centers. And in terms of affordability, along with the grants that we discussed above, last session we raised eligibility to 150% of federal poverty level. And with that, we have already seen record growth in the On My Way pre-K program. So this year we had over 8,000 children enroll in that program, which is an all-time record for us. And also, as I have mentioned in our prior calls, we are also focusing on quality in the childcare space. And as part of that, we are working really closely with our Early Learning Advisory Committee and working closely with the Department of Education on reforming our Path to Quality program. We have some initial approved ELAC recommendations, and you will likely see some of the work moving towards that, which will occur over this and the next several years. Lastly, not least, we are continuing our work on mental health reform around the state. We've spent a lot of time on these calls talking about our crisis response system in 988, but another area that's been really important to us is making sure that we can get services faster to individuals who are found incompetent to stand trial. Now, incompetent to stand trial means that an individual gets arrested who is deemed unable, either because of a mental illness or another condition, to be able to meaningfully participate in their own trial. Now, when that happens, those individuals are committed to the Division of Mental Health and Addiction here at FSSA to provide competency services to try to restore them to competency. And some of that is around training, some of that is around mental health services. Now, the challenge had been over the last several years is that we had wait times once somebody was found incompetent that could get as high as 4 months to get services predominantly provided in our state psychiatric hospitals. Now, we worked really hard over the last year and a half with our teams to address this wait time and have been able to reduce that from 4 months to now less than 2 weeks. And so that has been great progress, but it's not progress that we're stopping on, because we also recognize that it takes time to find somebody incompetent to stand trial. And so now that we can provide services much faster once they're found incompetent, we want to speed up the time it takes to make that determination. Because the sooner we can do so, the sooner an individual can get services, the sooner they can either be found competent or restored to competency, is the sooner they can go through their legal process. And so this session, we're hoping to reduce the number of mandatory competency examinations that have to occur in these cases from 2 to 1. One would occur if both sides, prosecution and defense, agree on it. And that would significantly speed up the ability for us to get some of those services. I did mention earlier, but we are continuing all the work that we have been doing around crisis response, and that's continuing to build upon our 988 call centers, which continue to be over 90% in-state answer rate and be among one of the higher states in the country. But as we've seen an increasing number of calls, we need to make sure that we continue that ongoing support. We continue to work on our mobile crisis team response and our crisis stabilization unit responses. And of course, we continue to move towards a certified community behavioral health clinic model. So there is a lot that we're continuing to do, and that will be ongoing in 2024. So as you can see, I've just touched on some of the bigger things, but we have got a lot that we're going to be doing here in the last year of this administration to get all of these things kind of much farther along and launched. So as part of that, we will continue to work with you all, and we will continue to keep you all updated along the way. Collectively, you all really do help us achieve our mission to compassionately serve this diverse community of Hoosiers that call Indiana home, and that we do so really through deliberate human service system improvement, like we have talked about here today in this call. And collectively, we will all work to make sure that Hoosiers can live in fully engaged communities, reaching their greatest emotional, mental, and physical well-being. So thank you all for tuning in today. And although I didn't talk about PHE, by all means, we've got 3 months left on the unwind. So again, to the extent that you intersect with folks who are on Medicaid, who are maybe on Medicaid, keep reminding folks to update their information. And thank you again for tuning in.